Hello, glad to be with you again from Unified Oski. I'd like to take us through A to E assessment with focus on end of life scenario. End of life is a grievous moment. The nursing approach is expected to be person centered and holistic, showing compassion, empathy, dignity, and respect. It is important to be flexible and receptive, respecting individual wishes and preferences, be it religion or culture. So, in your A to E assessment in OSCE, when you have an end of life scenario, the assessor wants to see you reflecting this empathy, compassion, and respect and dignity at this transition phase of life to a peaceful death. That is what they want to see you demonstrate. Okay, let's get started. As I approach the scene, I can confirm the scene is safe to approach, nothing to cause harm to myself or my patient. I ensure privacy is provided by pulling the curtain. I go ahead to do my hand hygiene according to WHO standard. Put an ample of gel around palm to back of hand, vice versa, palm to palm, fingers interlock, rotational rubbing of the thumb, rotational rubbing of the thumb, fingertips on palm, my wrist in rotational manner, allow my hands to dry for 30 seconds as I approach my patient. Hello.
Hi, nurse.
Yeah, my name is Ademola. I'm your attending nurse for today. I'm here to do an assessment on you following the A to E approach. Is it a good time to do that?
Yes.
Oh, great. But before we go ahead, I would like to confirm your full name, date of birth, as I confirm with the documents I have with me, and your ID band. Can you tell me your full name, please?
It's James Smith.
Wonderful. I've got James Smith on my document, and I can see James Smith on your wristband. Your date of birth,
8875.
I've got 8875 on my document, and I can see 8875 on your ID band. Yeah, and the hospital number is 1234 on my documents. I can see 1234. What would you like to be called?
James.
Okay, great. James, have you got any allergy to food, drugs, or latex?
No, nurse.
Okay, I can see there's no any documentation of allergy on my document. That's great. James, are you in any form of pain or discomfort?
Yes, I've got chest pain.
Oh, it's good to let me know. Can you rate your pain for me on a scale of 0 to 10, where 0 means no pain at all and 10 is the worst pain you can ever imagine? What will you rate your pain?
I would say a 6.
Oh, I can I know it's much discomfort for you. Can I just reposition the pillow to support you? Probably that would be helpful. Is that okay?
Yes, nurse.
Is that helpful?
Yes, nurse.
Can you take a deep breathe in and out? Wonderful. Is that helpful?
Yes,
Are you
nurse.
still happy for me to carry on?
Yes,
And
nurse.
I'm going to check your medication chart. And if you are due for any analgesic, I'll be right back to give that as soon as I'm done with the assessment. Is that okay with you?
Yes, nurse.
Wonderful. Have you been resting in the last 20 to 30 minutes?
Yes, I have.
Okay, good to know. So, like I said, I'm here to do an assessment on you following the A to E approach. I have my instruments here. I've confirmed with the assessor that it's been calibrated and it's ready for use. So I'm happy to go ahead. Please, can you make sure your legs are uncrossed, James?
Yes, nurse.
Okay. I'll be starting with checking your blood pressure. Is it okay to use your left arm?
Yes, nurse.
Okay. I'm wrapping the curve. I have the right size of curve. I'm wrapping it 2 to 3 centimeter above the antecubital fossa. Not too loose, not too tight, covering 80% of the upper arm. I'm going to put the pressure. You'll feel some tightness just to check your blood pressure. But as soon as I'm done, you'll be relieved. Is that okay with you?
Yes.
Okay. Yeah. And while that is going on, can I make use of your right finger, please?
Yes, nurse.
Okay. I would like you to put it at your chest level. Is that okay?
Yes, nurse.
Okay. I'm checking at your finger. I'm looking at the capillary refill. I'm depressing your fingernail for 5 seconds. 1, 2, 3, 4, 5. And I'm releasing it. I can see your capillary refill is less than 2 seconds. Okay. So the blood pressure is done. Your blood pressure is 110/50. I'm going to remove the cuff now. Thank you. Now, I'm going to check your pulse, and I would like you to be quiet for 2 minutes if you don't mind. Is that okay with you?
Yes, nurse.
Yeah, I'm trying to locate your radial artery. Is it okay to touch you?
Yes, nurse.
I'm locating your radial artery. So I'll be calm for 2 minutes and I won't be able to talk to you within these 2 minutes. Is that okay with you, James?
Yes.
Okay, thank you. Assessor, my time starts now. Okay, I'm done. Yeah, James, actually, I counted your heart rate for 1 full minute. No, checking the rate, the pattern of your heart rate. And I counted your respiration for 1 full minute, checking the rhythm and the depth of your respiration as well. Is that okay with you?
Yes.
But I didn't tell you that at the beginning because I didn't want it to alter the reading. Is that fine?
Yes.
Okay, so I'll document what I've gotten. So the respiration is 22 and your heart rate is 112, 112. It's a bit on the high side. The respiration is a bit on the high side. But I'll be back to let you know what the next action of plan will be. So at this moment, I would like to check your oxygen saturation. I'll be using your finger. Is that okay with you?
Yes.
Okay, I'm putting the probe. Let's just imagine. So I put the probe. Your oxygen saturation is on, is 95%. And I've checked your capillary refill before. Your capillary refill is less than 2 seconds. I've noted that. Okay. I'll be checking your temperature at this moment. I'll be using your forehead. Checking on your forehead, I can see there's no bleed, there's no rashes, and I'm happy to use it. You will hear a bleep sound. It's just your temperature reading. Is that okay with you?
Yes, nurse.
Okay. So I'm done with that. Your temperature is 36. It's a bit low, but I'll let you know the action of plan when I'm done. So I'm done with checking your with the assessments. I've done an assessment following the A to E approach. Starting from the airway, when I come in, I can see you can talk to me in complete 2 to 3 sentences. There is no noises with your sentences. You can talk to me well. So I'm happy with your airway. Your airway is not blocked. So moving to the B, which is the breathing. For the breathing, I check your saturation. Your saturation is 95%, which is a bit low. I check your respiration as well. I checked for the rhythm, the depth, the pattern, the regularity and irregularity of your respiration. For your respiration, I can see you breathing with your abdominal muscles, which is a sign of breathing with some level of difficulty. But apart from that, there's no noises, there's no wheezy, no rattling in your respiration sound. And for the chest movements, I can see the chest movements are okay. Now, moving to the circulation. For the circulation, I counted your heart rate for 1 full minute, noting the rhythm and the strength of your heart rate. Your heart rate is a bit on the high side, which is 112. And I check your blood pressure. Your blood pressure is 110 over 50. The 110 is like a borderline, but I will let you know the plan, like I said earlier on. I check your capillary refill time. Your capillary refill time is less than 2 seconds, which shows you are well perfused. And I can have a look at your extremities at well. I can see you are well perfused. Okay. D, which is disability. James, can you wiggle your hand for me? Can you wiggle your legs?
Yes.
Wonderful. Do you know where you are at the moment?
Yes, nurse.
Where are you, please?
I'm in the hospital.
Oh, wonderful. That means you are well oriented. And when I came in talking to you, I can see you well oriented. And you told me you are in pain, you've got chest pain, and I've promised to have a look at that to see if you are due for any medication, and that will be addressed as soon as possible. Hope the breathing, exercise, and the change in position is helpful, James.
Yes, nurse.
Okay, wonderful. James, have you passed urine in the last 1 hour?
Yes, I have.
Okay, wonderful. I can see you are passing water quite well. And assessor, can I confirm James' blood sugar, please?
Within therapeutic range.
Wonderful. So the blood sugar is within therapeutic range. I'm happy with that. Now, moving to the E, which is the exposure. On the part exposed on James' body, I cannot see any visible wound, bleed, or rash, except for the lower legs that are a bit swollen. And that is noted. James, you can just elevate your legs. So that will help to relieve the swollen on your legs. Is that okay with you?
Yes,
Assessor, can I confirm on parts covered on James' body if there's any parts, any wound, bleed, or rash? There is none. Okay, that's wonderful. And that will be all for now, James. I will quickly step aside to plot your news chart. The news chart is just to know the monitoring frequency. And I'll also be back to ask you on some questions on activities of daily living. Is that okay with you?
yes, nurse.
Yeah, here's the call bell. If you need anything, just press the bell and I'll be right back. I'll be plotting my news chart now. Plotting the news chart, I ensure the name is filled, the details are filled correctly, the date of my exam on the column for dates, the time, that is the time on my assessment form. I will fill the time there. Okay. For the respiration, I've got 22, and that gives me a score of 2. The SPO2, 95. I'm using scale 1. That's a score of 1. I'm not I'm not using scale 2. So I'm moving to the next stage, which is air or oxygen. James is on room air. I'll write capital letter A on that column. The blood pressure is 110/50. I'm scoring the systolic, but I'm plotting both the systolic and diastolic. So systolic of 110 gives me a score of 1. Heart rate is 112. That gives me a score of 2. For the consciousness, I'll write capital A in front of alert. Moving to the temperature 36, that gives me a score of 1. So my total new score is 2 plus 1 plus 1 plus 2 plus 1. I have a total new score of 7. In front of new total, I'm writing 7. My monitoring frequency based on this, I would turn to the back of the chart, and the monitoring frequency for a new score of 7 needs an urgent response. Okay, so I'll just put the monitoring frequency will be continuous because that needs an urgent response. And my escalation plan will be capital letter Y, which is yes. I'll put my initials on the last column, and I'll be going back to James. Hello, James. I'm back.
Hi, nurse.
Yeah, are you okay?
Yes, nurse.
Okay. I'm done with your new score, and you've got a total new score of 7. And based on that, I will escalate this to the registered nurse immediately. And the registered nurse will inform the medical team and the critical care emergency review for competencies. And if need, they will put you on level 2 or 3 clinical care. There may be need to transfer to ICU or high dependency unit based on the standard news assessment. But James, I quite understand the prognosis of your heart failure at this moment. I I know it's a difficult time at this time. So I will want to let you know we're going to respect your preference, your wishes. We will not going to intervene unnecessarily. Okay? Yeah, so are you still happy for me to ask you some questions on activities of daily living?
Yes, nurse.
Okay. And how is your mobility? Are you able to mobilize?
Yes, but I feel tired after a few steps.
Oh, I'm sorry about that. I would want to assure you just little as you can and don't put yourself under pressure. And if you don't mind, I will also be referring you to the occupational therapist and physiotherapist, and they will be able to help you on that for better assistance. Is that okay with you?
Yes, nurse.
Okay. I want to ask about your nutrition. What's your nutrition like? Are you able to eat? Are you
Not
eating well?
not much really. I've lost my appetite.
Oh, sorry about that. I can understand. But I would just like to advise you to take, few meals at regular interval, as much as you can tolerate. Then your food preferences, just let us know. We will try within our possible best to provide what your preferences are. Is that okay with you, James?
Yes, nurse.
Yeah, James, I would like to ask what's your special wish or request at this time?
I want my wife to be on my side,
Oh, that's lovely.
and I want a picture of my dog Fluffy.
Oh, so touching. Oh, we want to assure you that we will respect your wish and preference, James. Is that okay with you?
Yes,
So anytime your wife wants to come in, she's free to come in. She's free to always be by your side. Is that okay?
yes, nurse.
Oh, wonderful. Do you have any spiritual wish at this time?
Yes, I would love for the chaplain to have a visit.
Okay, I'm going to arrange that. We have a chaplain within the hospital. I'm going to give a referral and they will be right here to see you. And you have a special wish for your own chaplain, just let us know. That will be fine as well. Okay, James.
Yes, nurse.
Do you have any question, any concern for me?
Um, no, nurse.
Are you okay at the moment?
Yes.
Okay, I can see your legs are swollen, like I said. Just try to elevate it, and that will be helpful. We also like to refer you to the palliative team. The palliative team, they help to give a pain free care at this time. Part of the things you complain about chest pain. So the palliative team may want to have a look and see how they can give you a pain free comfort at this time. Are you happy for me to give a referral?
Yes.
Okay, so I'm going to ensure that is done. And if there's any other thing, please just press the bell and I'll be right here. Is that okay?
Yes, nurse.
And that will be all for now. And I'll see you again, or just press the bell whenever you need any help. Okay, I will do my final hand hygiene. And that will be all for your A to E assessment at end of life. Thank you.